The phrase war on drugs has been a rallying cry in American politics since it was first coined in the early 1970s. But decades later, the results of this so-called war are deeply contested. To understand whether America has lost the war on drugs, we need to examine its origins, policies, impacts, and the stark realities that persist today. The war on drugs formally began in 1971, when President Richard Nixon declared drug abuse public enemy number one. This marked the start of a comprehensive federal policy aimed at reducing drug use through law enforcement and criminalization. Billions of dollars were allocated to anti-drug programs, and Congress passed strict sentencing laws for drug offenses. Over time, these efforts escalated. In the 1980s, President Ronald Reagan reinforced the war on drugs with zero-tolerance policies and mandatory minimum sentences. The Anti-Drug Abuse Act of 1986 introduced harsh penalties, particularly for crack cocaine, a drug disproportionately associated with black communities. These laws created stark sentencing disparities. For example, possession of 5 grams of crack cocaine carried the same penalty as 500 grams of powdered cocaine. Despite decades of effort and expenditure, the war on drugs has yielded mixed results. On the one hand, drug use trends have fluctuated, with some substances declining in popularity and others rising. For instance, heroin and methamphetamine saw surges in the 1990s and early 2000s, while prescription opioid abuse skyrocketed in the 2010s. The cost of the war on drugs has been staggering. The U.S. government spends an estimated $47 billion annually on drug enforcement, incarceration, and treatment programs. Yet, drug addiction and overdose rates remain at historically high levels. In 2021 alone, over 106,000 Americans died from drug overdoses, a grim record fueled by the rise of fentanyl and synthetic opioids. One of the most significant criticisms of the war on drugs is its impact on the criminal justice system. The U.S. leads the world in incarceration, with nearly 2 million people behind bars. A significant portion of this population is incarcerated for drug offenses, often non-violent ones. In 2020, over 1 million arrests were made for drug law violations, with 86% for possession rather than trafficking. The racial disparities in drug enforcement have further fueled debates about the effectiveness and fairness of these policies. Black Americans are nearly 4 times more likely to be arrested for marijuana possession than white Americans, despite similar usage rates. These disparities have led to calls for reform, with critics arguing that the war on drugs has disproportionately targeted marginalized communities while failing to address the root causes of addiction. Another major consequence of the war on drugs is its impact on global relations. The U.S. has historically exerted pressure on countries like Colombia and Mexico to combat drug cartels, often funding military operations and anti-drug initiatives. While some progress has been made in disrupting drug production and trafficking, these efforts have also led to violence, corruption, and political instability in these regions. In recent years, public opinion has shifted dramatically regarding drug policy. A majority of Americans now support the legalization of marijuana, which is already legal for recreational use in 23 states and for medical use in many others. This trend reflects growing recognition of the potential economic benefits of legal cannabis, as well as skepticism about the effectiveness of criminalization. Decriminalization and harm reduction strategies are gaining traction as alternatives to traditional drug war tactics. Programs like needle exchanges, supervised injection sites, and medication-assisted treatment have shown promise in reducing overdose deaths and improving public health outcomes. Portugal's decriminalization model, which treats drug addiction as a public health issue rather than a criminal one, is often cited as a potential roadmap for U.S. reform. The opioid crisis has further underscored the limitations of the war on drugs. Unlike illicit substances, opioids were initially promoted by pharmaceutical companies and prescribed by medical professionals. The crisis revealed gaps in oversight and accountability, demonstrating that the root causes of addiction are complex and multifaceted. So, has America lost the war on drugs? Many argue that the metrics for success were flawed from the start. If the goal was to eliminate drug use and addiction, the evidence suggests failure. Substance abuse remains a pervasive issue, with new drugs and challenges constantly emerging. However, others contend that the war on drugs has succeeded in some respects, such as disrupting major trafficking operations and raising awareness about the dangers of drug use. The debate ultimately hinges on whether the societal costs, incarceration, racial disparities, public health crises, outweigh the perceived benefits. Looking forward, the future of U.S. drug policy will likely involve a mix of approaches. Comprehensive reforms, including decriminalization, expanded treatment options, and education campaigns, are critical to addressing the shortcomings of the current system. Moreover, policymakers must balance enforcement with compassion, recognizing that addiction is as much a health issue as a legal one. The war on drugs remains a deeply polarizing topic, reflecting broader tensions in American society about justice, equality, and the role of government. As the nation grapples with these challenges, one thing is clear. The fight against drugs will continue to evolve, shaped by changing public attitudes, scientific advancements, and the lessons of history.